Hello everyone, I'm Angeline Kiribai, Assistant Professor, Department of Biotechnology, St. Joseph's College of Arts and Science for Women, Hosur. Today we are going to see about sterilization. Sterilization is the removal of all forms of microorganisms from the surface of an object. It includes both spore and vegetative forms. It complete destruction of microbes. Sterilization is done to avoid the growth of microorganisms which may grow on the surface of an object, if left without killing the germs. It is, however, different from disinfection or sanitization, where only reduction of the microorganisms takes place rather than total elimination. After sterilization, an object becomes sterile or aseptic. History of ancient burning chemicals to allow fumes to deteriorize or disinfect. Poet Homer, Odyssey, sulfur purification. Moses, purification by fire. Aristotle, boil drinking water and bury waste. Hippocrates, boiled water for irrigating wound. Then modern, about sterilization. In 1775, Spallanzani, boiling of microbes in a sealed flask for 1 hour. In 1880, Chamberlain's autoclave, first steam sterilizer. In 1885, Schimmelbusch, steam sterilization of surgical dressings. In 1963, glutaraldehyde, it's the first liquid chemical sterilizer as a sterilant for heat sensitive instrument. Terms. These are all the some important terms about in sterilization. Sterile, items that have been rendered free of living microbes including spores. Sterile field, specified area, usually the area immediately around the patient that is considered free of microbes. Surgical clean, items mechanically cleaned and chemically disinfected but not sterile. Terminal sterilization, to render items safe to handle by sterilization. These are all the classification of sterilization methods. There are two types, physical methods and chemical methods. Under the physical methods, it comes heat, radiation, filtration, all it comes under physical method. Then gas and liquid type of sterilization comes under chemical method. In heat, it classified into further dry oven, pressurized steam, pasteurization. In radiation, there are classified to X-rays, Y-rays, and ultraviolet rays. And filtration, then gas liquid and liquid form of sterilization methods. Methods of sterilization. The various methods are sterilized. First one is physical method. It's classified into further thermal method, radiation, filtration. Second one is chemical method. It's classified into gaseous method and liquid. Dry heat sterilization. Dry heat sterilization of an object is one of the earliest form of sterilization practiced. It uses hot air that is either free from water vapor or has very little of it, where this moisture plays a minimal or no role in the process of sterilization. Example of dry heat sterilization include hot air oven, incineration and flaming. Objects that cannot get wet, glassware, oils, powder, metal instruments and paper wrapped items use dry heat for sterilization. Then moist heat. Moist heat sterilization describes sterilization techniques that use hot water vapor as a sterilizing agent. Heating an article is one of the earliest form of sterilization practiced. The various procedures used to perform moist heat sterilization that cause destruction of microorganisms by denaturation of macromolecules. Autoclave, it is a type of moist heat sterilization. An autoclave is a sophisticated pressure cooker with a chamber where water is added and heated to form steam. As the heating continues, pressure is built inside an autoclave. As the pressure increases, the temperature of a steam also rises. Eventually, the heat penetrates the material being sterilized, killing the microorganisms and any present microbial spores such as endospores. Ionizing radiation, a low temperature sterilization method that has been used for a number of medical products. Example, tissue for transplantation, pharmaceuticals, medical devices. The types of ionizing radiation: alpha particles, beta particles, positrons, gamma rays, and X rays. In chemical sterilization, chemical sterilization involves the use of chemical agent to kill unwanted microorganisms such as fungi, bacteria, viruses, and other disease causing agents. Liquid and gas sterilizations are chemical methods of eliminating all viable microorganisms and spores. Ethylene oxide. Ethylene oxide gas is one of the most common ways to sterilize medical devices. A safe, tightly controlled, highly regulated process which is critical for preventing infections and ensuring patients that have safe surgeries and medical treatments. Types of chemical sterilization. Gaseous sterilization is the first method. In this method, the object is exposed to the gas in a closed, heated, and pressurized chamber. The gaseous chemical agents used for sterilization include ethylene oxide, formaldehyde, nitrogen dioxide, and ozone. The next one is liquid sterilization. Liquid sterilization is the process of immersing the object in a liquid such that it kills all the viable microorganisms and their spores. This method is less effective than gas sterilization and is used to remove low levels of contamination. Common liquid chemical agents that are used for the sterilization include hydrogen peroxide, glutaraldehyde, hypochlorite solutions. Thank you so much. This is all for sterilization methods.